Hey, good morning and welcome to UroNurse News. Be sure to like and subscribe. Today's story looks at a question many providers and patients have wondered for years. When surgical androgen deprivation therapy is needed for advanced prostate cancer, does the type of orchiectomy affect how patients feel about the procedure afterwards? A new systematic review suggests the answer may be yes. Let's take a closer look. Researchers from the University of Gadjah Mada in Indonesia reviewed the available evidence comparing subcapsular orchiectomy with total orchiectomy for men with advanced prostate cancer. The analysis included 12 comparative studies, 8 randomized controlled trials, and 4 non-randomized studies. 759 total patients. Of those, 366 underwent subcapsular orchiectomy, 393 underwent total orchiectomy. Unlike previous research comparing surgery with medication-based hormone therapy, this study focused solely on comparing the two surgical techniques. That provides clinicians with a clearer picture of how these operations compare. The biggest finding, patients who underwent subcapsular orchiectomy were nearly 4 times more likely to report satisfaction with their procedure. The odds ratio was 3.78, a statistically significant difference. Why might that be? Researchers believe it may relate to the preservation of the external appearance of the scrotum, resulting in a better body image following surgery. Although both procedures remove the hormonal function, the subcapsular technique leaves the outer shell of the testicle in place, creating a more natural appearance. And you can kind of see from those pictures over there, total orchiectomy, the whole testicle is removed. Subcapsular, they're only removing that inner portion. Makes a difference. It still looks more like the real thing on the outside. And for many patients, the cosmetic difference may have meaningful and psychological benefits. One concern has always been whether leaving residual tissue behind could reduce cancer control. The analysis provides reassuring news. Although men undergoing subcapsular orchiectomy had slightly higher testosterone and PSA levels, those values still remain within the accepted medical castration range. Remember, the injections don't bring you down to 0 either. Researchers found similar quality of life scores, similar hormone-related symptoms, similar functional outcomes. No evidence of worse cancer control. No difference reported in 3-year survival. Importantly, the remaining testosterone after subcapsular surgery did not preserve fertility, libido, or endocrine function. So despite measurable laboratory differences, the clinical outcomes appear comparable. So what should urology professionals take away? The authors conclude that subcapsular orchiectomy may represent an excellent surgical option for selected patients with advanced or metastatic prostate cancer. Potential advantages include higher patient satisfaction, better preservation of body image, comparable cancer outcomes, and low overall cost. However, the investigations also emphasized an important limitation. The available studies remained relatively small. Some data were incomplete, and additional multi-center randomized trials with longer follow-up are still needed. But for now, these findings support both surgical options during shared decision-making, especially for patients who place a high value on body image and quality of life. Today's bottom line, while total orchiectomy produces slightly greater testosterone suppression, subcapsular orchiectomy still achieves effective medical castration and appears to provide significantly greater patient satisfaction, likely because of improved cosmetic outcomes. It's another reminder that successful cancer treatment isn't measured just by laboratory numbers. It's also measured by how patients live after the treatment. I'm Vic Senese. This has been UroNurse News. Hey, tomorrow on UroPatient, your prostate MRI shows a PI-RAD4. Now what? Seeing PI-RADs 4, maybe 5 on your MRI report can be alarming. Does it mean you have prostate cancer? Do you definitely need a biopsy? Or is there more to the story? Check that out on UroPatient this Saturday at 10:30, and I'll explain it all. Tomorrow on UroNurse News, could the bacteria living inside your bladder determine which overactive bladder treatment works best? New research reveals that New research reveals that unique urinary microbiome profiles may distinguish OAB patients from healthy individuals and even predict treatment response. We'll explain how artificial intelligence, microbiome science, and precision medicine could change the future of bladder care. So join me tomorrow for another evidence-based update you don't want to miss.
Thanks for watching UroNurse News. The expert's opinion in this communication are personal and not representative of any organization. They are for informational purposes only, not official guidance. Viewers are advised to use their judgment, seek additional advice, and take responsibility for any actions based on these opinions.